Thank you so much. Welcome, everyone. I am so delighted to be with you here today. My name is Daniela Ligero, and I am the CEO of Together for Girls. I am also co-founder of the survivor-led Brave movement. Again, we're so excited to have you with us today. As Chris mentioned, there is translation in Spanish. Hay traducción en español para los que deseen. Buenos días a todos y todas. We are super excited to be here for our first webinar in the Implementation Science Collaborative's Evidence to Policy webinar series, Protecting Children from Violence. And it's amazing to have people from all over the world joining us today for this seminar. I just want to note that we do have not only the translation, but this conversation is being recorded and will be available both on the Implementation Science Collaborative's website and the Together for Girls website. And this series is co-hosted by Together for Girls, my organization, as well as East Central and Southern Africa Health Community, Universidad de los Andes, University Research Collaboration with support from USAID's Health Evaluation and Applied Research Development, HEARD project. So thank you to our partners. Thank you to everyone that's here today. Why are we here? Why are we here today at this webinar? The truth is that if you stop learning, you stop growing. And all of us here today are connected by a common cause, and that is to end violence against children in all its forms, wherever it happens. And we can and must do better for children. And in order to do so, it's important for us to learn from what we've done already so that we can continue to grow and do better. And the landscape analysis that we are going to be discussing today really showcases a decade of learning, a whole decade of learning. And it's called Using Data to Inform National Efforts to End Violence Against Children, Country Experiences and Lessons Following Violence Against Children and Youth Surveys, or the VACS. So what are the VACS? The VACS are nationally representative population surveys that look at violence against children, adolescents, and youth. We'll be hearing a lot more about them, but they've been done in over 23 countries now, and they're done as part of the Together for Girls partnership led by national governments with support from CDC, USAID, UNICEF, many other global partners, as well as local partners like civil society, different kinds of networks, universities, et cetera. And each country is a little different, but now we have a decade of learning to show what's happened in all these countries and how can we use that information to do better. At this point, we have data through VACS for over 10% of the world's population between the ages of 13 and 24. And if you look at low-income countries, we actually have data for 20% of the children, adolescents, and youth living in those countries. So it's really a massive amount of information. And this landscape analysis we're going to be discussing today provides the first really comprehensive view of the VACS, but more importantly, the data to action process that the VACS starts. And it synthesizes the views of 225 stakeholders that were interviewed from over 20 countries spanning 4 regions. And this analysis, as you'll see, really shows areas where we've made significant progress together, working together, but also areas for growth, for improvement, and for priority action. As the principle of data to action highlights, VACS is not just about having data. It's about how those data are used. So it's putting it into action to influence policies, programs, prevention, healing, justice. If you want to find out a little bit more about all of this after this webinar, feel free to go to the Together for Girls website, and you can learn a lot more about the VACS, data to action, and that whole process. But we hope to give you a really good sense of all of that today during our webinar. And the way we're going to do it today is we're going to start with 2 different presentations by Dr. Greta Massetti from the CDC and Dr. Kathleen Crivero from the City University of New York. Then we're going to have a great panel. I'm so excited to have a Q&A, a conversation with our panelists, followed by some Q&A in closing. So we have a packed agenda for you And I'm excited now to move on and present Dr. Greta Massetti, who is a longtime partner, a friend. She is the branch chief of the Field Epidemiology and Prevention branch and a senior epidemiologist of the Division of Violence Prevention of CDC's National Center for Injury Prevention and Control. She serves as the lead for the Global VAX to determine the magnitude, the epidemiology, the health impacts of violence against children in multiple countries. We're so honored to have Dr. Greta Massetti of the CDC with us. Over to you.
Hello, and thank you so much for having me on this webinar today. My name is Greta Massetti, and I'm from the U.S. Centers for Disease Control and Prevention. I'm going to share my slides today where I will be presenting an overview of our violence against children and youth surveys and our data to action process to support countries in preventing and responding to violence against children. Violence against children and youth is a global human rights and public health crisis. 1 billion children experience some form of violence every year. That's half the children in the world who experience sexual, physical, emotional violence, or a combination. Violence doesn't just affect children in terms of the immediate consequences. It also causes ripple effects that reverberate through a child's life, including impacts on mental health problems, maternal and child health issues, life opportunities, risk behaviors, and disease outcomes that are chronic and longstanding. Our work at CDC involves supporting countries in making use of the best available data to inform public health action to prevent and respond to violence globally. This work really started in Swaziland, or what it is, the country that is now known as Eswatini, in 2007, to really identify strategies to collect high quality data on violence against children, its consequences, its risk and protective factors, and its context, and use that data to really drive programmatic action. Since 2007, the surveys have grown exponentially, and we have supported about 27 surveys across the world in using collecting high quality data and using the data to inform public health action. This work is really supported through efforts to use the data through a data to action tool and workshop to inform implementation of INSPIRE, and a technical package of 7 strategies to end violence against children. INSPIRE was developed by CDC and the World Health Organization in partnership with 10 international agencies, and uses the best available information that has shown what works to prevent violence and respond to victims in a supportive way. CDC's data to action efforts really rely on a framework and certain design principles that ensure that the best data are leveraged, utilized, and applied. Our design principles include use of the robust data elements. The better the data, the more high quality the data and the data source, the better driven the information can be. Also, the use of a technical package that has evidence-based interventions. We know what works. We just need to make sure that the right things, the effective interventions, are put in place on the ground. There also need to be explicit linkages between the data and the technical package components so that we understand how to use the data to inform decisions about public health action. There needs to be a process for ensuring multi-sectoral engagement of key decision makers throughout the data to action life cycle. This include linkages to national priorities that are important to governments, national commitments from governments to support efforts to prevent and respond to violence. And then finally, countries often need technical assistance and capacity building support to interpret and apply data findings to violence prevention implications to ensure that those data are used in an effective and reasonable way. The key areas for achieving this work is through INSPIRE, rely on the use of a clear logic model that links the risk and protective factors to the outcomes of interest. a technical package that synthesizes the evidence and the literature, monitoring tools to ensure that the right interventions, the chosen interventions, are implemented with quality on the ground, partnerships to ensure we have multi-sectoral engagement across sectors and across ministries and civil society and non-government organizations, communication and coordination to support those partnerships, and a political commitment to ensure that there's a follow-through on intentions and actions. From using the VAX data through our data to action process really involves an extensive life cycle that starts with very early engagement through mobilization of efforts, ethical review and field work for the surveys, data collection and dissemination, and all of that really leads into a translation process where INSPIRE technical package is used to inform planning and strategic development of a national action plan for program implementation. The 7 strategies for INSPIRE include those that are listed on this slide, such as implementation and enforcement of laws, norms and values, safe environments, parent and caregiver support, income and economic strengthening, response and support services, and education and life skills. These are the strategies that are essential components to ensuring that children are supported and have an opportunity to thrive and develop into happy and thriving youth throughout their lifespan. There are VAX data elements and indicators that directly measure each of the INSPIRE strategies, and it is those data elements that are used to inform decisions about the strategies and programs to implement to prevent and respond to violence. The objectives of the data to action framework include interpreting the key findings from VAX data, using data to develop priority topics within and across sectors, identifying ways to strengthen and expand the response to violence against children through both the INSPIRE strategies as well as actions backed by data and evidence. And then the objectives of the data to action approach are to form the basis for multi-sector national action planning and identifying next steps to prevent violence against children. I'm going to give a brief example of one place where this has been done in a comprehensive way. In Kenya, there was a violence against children and youth surveys that was first implemented in 2010, and there was then again repeated in 2019, and this allowed the country to establish and update a national response plan that covered 6 strategic areas aligned to INSPIRE. The response plan was first established in 2010 and then updated in 2019 with new data. And the response plan recognizes the successes, but recommits to prioritizing violence prevention. It really reflects tremendous success in Kenya in demonstrating declines in violence in every form of violence against children, both females and males. So this survey, this slide shows that from 2010 in the blue bars to 2019 in the orange bars, there were significant reductions in lifetime sexual, physical, and emotional violence for both males and females, showing significant improvement over 10 years in every form of violence for young people. This is really done through a policy and programmatic effort that involves planning, data to action, often kicked off by a workshop to really intensively unpack the results of the surveys and inform action, development of policies and plans through multi-sectoral coordination, and then implementation and monitoring and evaluation efforts. So this is really a comprehensive process that is iterative and multi-sectoral at heart. And this is where I'm going to turn it over to my colleagues. Again, thank you so much for letting me join this webinar today.
Thank you so much, Greta. We really appreciate that presentation. Thank you for being with us. Now we're going to listen to another presentation, and then we'll switch over to our panel discussion. It is my great honor to introduce Dr. Kathleen Crivero, who is really a true leader in our field when it comes to ending violence against children. Right now, she's worn many hats, but right now she's the co-director of the Center for Immigrant, Refugee, and Global Health at the City University of New York. And on the HEARD project, she works to improve the scope and impact of national vax. Thank you, Dr. Crivero, for being with us today.
My name is Kathleen Crivero, and I'm pleased to have this opportunity to present to you the results of a collaborative effort to show the power of data to action using the Violence Against Children and Youth surveys. The presentation highlights key findings and recommendations of a landscape analysis that was conducted by the University Research Company and the City University of New York Graduate School of Public Health and Health Policy through generous support of the U.S. Agency for International Development. We also benefited from, there were 3 primary authors. We benefited from research support from colleagues at City University, as well as tremendous support from staff of Together for Girls and an advisory group that represented a broad range of organizations. In this presentation, I'll talk a little bit about the analysis and present the key findings and the recommendations. First, the analysis. This was the first analysis of its kind done to learn more about what has facilitated and hindered the transformation of data into action using the Violence Against Children and Youth surveys. And I think Dr. Massetti from CDC has gone over what those surveys are, what the different phases of them are, but this landscape analysis was designed to find out more about what allowed the data that we got to turn into positive action for children. Now, we were in touch with over 225 participants during this landscape review. 177 of them responded to a written survey, and we did 48 in-depth interviews with key informants. Both groups of stakeholders included government officials, officials of bilateral and multilateral organizations, representatives of local non-governmental organizations, and international organizations focused on children. So it was a broad range of stakeholders involved in the surveys and in post-survey action. So what were the findings? Today, I will talk about 6 of these findings. The first is that VAX data and associated processes to use the data provide evidence that violence against girls and boys is a knowable, solvable problem. Those of you that have been working on this problem for some time know that that's a breakthrough, because it's often been surrounded by a fatalism and the idea that it's just too deeply embedded in societies and social norms to address effectively. But the Violence Against Children and Youth surveys provide a foundation for developing interventions that work and a basis for measuring progress toward the Sustainable Development Goals, in particular 5.2, Target 5.2, and 16.2, which are highlighted in this slide. The second key finding is that VAX data drives change. The data that we obtain from VAX does influence decision makers. It influences their level of knowledge and awareness and their commitment to change and prioritize interventions that will end violence against children. The VAX findings also drive broad-based multi-sectoral systems change to address violence against children and youth and gender-based violence. For example, our respondents to the survey were very clear. This pie chart shows that 75% of the respondents to the survey felt that the violence against children, the data from violence against children and youth surveys influenced the design of national plans, policies, and programs. Another key finding is that coordination across sectors is critical to driving change. Wherever we found, in whatever countries, there was effective follow-up to the Violence Against Children and Youth surveys, it was driven by a broad multi-sectoral group. This group most of the groups depended on a variety of tools, two of which were covered in Dr. Massetti's presentation on data to action workshops and Inspire. So I won't go into those two tools here, but they were widely identified as critical to success. We also found out about what sectors are most involved in the follow-up to VAX. And you can see it's not surprising that child welfare, health, education, and gender ministries would be, but there was high levels of engagement from justice and security ministries, from statistical agencies, a little less from finance, which is important to get more finance engagement, since these finance ministries tend to have a great influence over budgetary allocations and funding, but also civil society groups. And it wasn't that civil society groups were not engaged in VAX, but their engagement varied greatly across sectors and across countries. And it seemed stakeholders felt that if there was a greater level of consistent civil society engagement, that would improve follow-up to VAX. Another key finding is that VAX data generates learning and action. It's associated with enhanced capacity building, the development of other tools and materials. Some of these are highlighted at the bottom of this slide, and that the VAX data, if accessible and user-friendly, made a big difference to capacity building processes. You can see here, this is taken from the results of the surveys, that stakeholders identified a number of areas in which the VAX data made a difference. They made a difference in amending and improving existing laws and regulations, in banning child marriage, in banning corporal punishment, in improving staff capacity, in developing new initiatives for the safety of girls, and for getting related questions and indicators into ongoing national surveys and national statistics. Another key finding was the need for more funding for all aspects of follow-up of violence against children and youth surveys. This was highlighted by the stakeholders that answered the written survey, where almost 90% of the survey respondents cited inadequate funding as a barrier to action and follow-up. And in addition, when we did the in-depth interviews with key informants, they were very specific about the range of actions that required more funding, including the development and improvement of NAPs, the training materials, system strengthening, support for community action. We include in this bar chart an idea of the importance and priority given to each of these areas. But the bottom line is that we know that VAX are underfunded in almost every sector in every country in which they've been done so far. The last finding I'll focus on today are that VAX launches are key to raising awareness and commitment. I think, as Dr. Massetti highlighted, once the data is collected, it's analyzed, it's shared with government, and other key stakeholders have a chance to absorb and reflect on the data and its implications, launches are held. And we found, as a result of the landscape analysis, that these launches actually made a big difference in raising awareness and commitment. If specific pledges were made, there was a broad range of stakeholders, and government was very genuinely and intimately involved. So you can see here that from survey respondents, over 55%, or over 50% of the respondents felt that these VAX made a difference in how follow-up occurred afterward. So the last part of this presentation will talk about the recommendations that we derived from the findings. The first recommendation is that VAX data is an important tool to inform and drive systems change, system-based actions across sectors to prevent and respond to violence against girls and boys and young people. And we identified 4 key components of that: the need for context-specific and user-friendly materials and tools, the need to strengthen capacity in a range of technical and operational areas, the need to address the disparities in that capacity between central and more rural or remote areas in many countries, and the need to integrate VAX indicators into ongoing national materials and surveys to avoid just having surveys happen every 5 years, but actually to make this part of what the government collects on a regular basis. Second is that we need strong government leadership and coordination across sectors. There was great acknowledgement and recognition of the support that had been provided by external actors, but broad consensus that it has to be government leadership and government coordination that drives follow-up to violence against children and youth surveys. Again, as I mentioned earlier, we found that stakeholders were really promoting increased involvement of civil society, including survivor-led and centered organizations, stronger accountability measures, and the need to ask specific questions and design actions for different groups, different ages, gender identities, ethnicities, disability status, etc. The third recommendation that we derived from the findings was that there's an urgent need for more funding for ending violence against children and youth and gender-based violence. And stakeholders were quite specific. Not only does the funding need to be greater in scale, but it needs to be more flexible to allow local stakeholders to respond to needs as they evolve, and it needs to be longer in duration because too many grants or funding awards are for 6 months or for a year, which doesn't allow the time for change to take root and to really make a difference for children. And lastly, that there needs to be greater advocacy with both governments and donors for greater priority and attention to violence against children and youth surveys, both to get them done in more countries and for stronger and longer and more sustained follow-up once the surveys take place. We highlight a quote from Nelson Mandela in the summary report, which states that history will judge us by the way we treat our children. If this is true, and we believe it is, then violence against children and youth surveys deserve more attention, priority, and support from all of us now and in the years to come. Thank you very much. And the summary report and the landscape analysis is provided in the links for this Zoom session.
Indeed. Thank you so much, Kathleen. Amazing. History will judge us by how we treat our children. That was a fantastic presentation. I am so excited now to move to our panel discussion. And we have two amazing panelists, and I'll introduce them now. We have Vivienne Mangoli, who is the Principal Children Officer at the Directorate of Children's Services with the Ministry of Labor and Social Protection in Kenya. We heard a little bit about Kenya, and it's great to hear more about what's happening in Kenya. She has over 12 years of professional experience in child rights, protection, programming, and advocacy. And she has been intimately involved in formulating and implementing child policies and plans, including the National Prevention and Response Plan for 2019-2023 that Greta Massetti flagged, focused on ending violence against children. And she is currently the lead technical officer on ending violence against children in Kenya. Welcome, Vivienne. We also have Arturo Harker Roa, who is the director of Imagina, an applied research center at the Universidad de los Andes that produces and disseminates evidence for the design and implementation of interventions, strategies, and public policies to promote the well-being of children and youth. He is interested in understanding the impact of adverse childhood experiences, such as exposure to violence, forced displacement, and collaborating in the design and evaluation of interventions that mitigate impact and improve health, education, and protection systems. Thank you, Arturo, and thank you, Vivienne, for being with us today. I'm so excited to have this conversation. I was wondering, Vivienne, if I could start with you, and maybe you could tell us a little bit, briefly describe how the VAX data and the data to action process has really advanced knowledge and action in Kenya. Over to you.
Thank you, Daniela. The VAX data for us, Kenya, has really helped inform, helped us understand the context in which we are operating in, context in terms of where violence occurs, who the perpetrators are, and it has also helped us identify the evidence-based interventions that we need to undertake based on data. And it has also helped us develop the action plan that we have informed on evidence. So we now know the prevalence of violence in this country and what we need to do, or what we need to do to address the magnitude of violence. And this we have done, Kenya, we have gone steps ahead and launched the VAC results. We did this in 2020 because of COVID complications. We did this in 2020. And then we also developed the National Prevention and Response Plan. And while doing this, what we found critical was the need to have a multi-sectoral coordination and collaboration. That for us was very, very critical because it gives a sense of ownership to the different agencies that are involved. In addition, it also helps to incorporate the actions that they together come up with in the work plans and targets that each individual agencies have. And in the spirit of working together, we are able to leverage resources. Yes. And then in terms of dissemination, it's not just about launching the results. It's also about disseminating these results to the duty bearers so that we are in a position to understand what is expected of us and what really works based on data to reduce violence that we can actually apply and implement as duty bearers in the country. So dissemination has also helped us to conduct further research. We have seen that as a result of the VAX data, further research has been done. For example, there is a paper on comparison of the 2010 and 2019 surveys. We are also looking into researching on why it reduced in 2019. The data showed that violence reduced. So there must be something that Kenya is doing to end violence against children, and research is being conducted to find out what happened in terms of programmatic actions and in terms of strategies that are being led either by government or any other non-state actor. The National Prevention Plan, if you allow me to go into that, was costed. Our National Prevention Plan and Response Plan was costed. And costing it has really helped us to influence how the increased budgetary allocation from government, because now we are able to approach our treasury and say that this is approximately how much it costs us as government to implement this particular plan. And as a result, the government has been able to listen to us and prioritize the promotion of prevention and response to GBV in the medium-term plan 4, which is what the strategy that Kenya uses to implement Vision 2030. And then in terms of monitoring and evaluation, I'm proud to say that we have in place a child protection information management system that is helping us track the implementation of VAC's cases. We are also developing data tools, and we have developed data tools, and we have put in place an M&E framework, which we are monitoring the implementation of the National Prevention and Response Plan. Thank you.
Thank you so much. Amazing. And I just want to really flag two things you said. One was around finance and kind of further involving finance. And that was a key finding, of course, that, Kathleen presented earlier, the importance of that. And just to flag for participants that Greta presented this briefly, but the fact that there was this change in violence at a population level in Kenya that you just referenced, Vivian, is so important. There are few countries in the world where that's actually been evidenced. So there's something happening in Kenya, and really understanding can be a lesson and an example for the world around how Kenya was able to reduce violence at a population level. So it's super exciting, and your leadership really is important for the children in Kenya, but also globally. Arturo, let me go over to you and ask you the same question. Tell us a little bit about Colombia, and what are the changes you've seen, and how has this process accelerated action in Colombia?
Thank you, Daniela, and thank you for this invitation. It's an honor to have this space to tell you a little bit about what happened in Colombia. So many things happened, so I'm going to try to summarize, but we had the VACs implemented in Colombia in 2018. Before that, the country and policymaking relied on administrative data, that even with the obvious reporting bias of the source, it gave a scenario that was overwhelming, but it raised more questions, and at the end of the day, it didn't help us raise the awareness we needed. We knew, for example, that the National Forensic Agency had the frequency of cases. We knew that every day on average 62 cases of sexual violence were reported, 66 cases of intrafamily violence, 35 cases of interpersonal violence, and 2 violent deaths, which are numbers that are unacceptable. But this didn't help us to identify clear epidemiological patterns, and especially the important learning about protection and risk factors. So thanks to the VACs, now Colombia has this diagnosis of these epidemiological patterns, and we are starting to understand, specific protection and risk factors. The VACs was obviously a collective effort. As Vivian mentioned, the Ministry of Health in this case was the leading agency, but it had a huge support from the International Organization for Migration, the U.S. Agency for International Development, obviously the Centers for Disease Control and Prevention, and Together for Girls, and the U.S. government. So it is important to highlight also that this actual process of the implementation of the VACs in Colombia started in 2015. When we did the translation to Spanish of the survey, especially we did a cognitive lab study to evaluate the need for adaptations to the context, which is very important. And this work helped to configure a Spanish VACs that was then implemented in El Salvador and Honduras. So why is it so important, the VACs, as Greta and Daniela and everybody mentioned already? It started mobilizing, things started to happen. In 2019, Colombia joined the Global Alliance Against Violence Against Children, and became a pathfinding country. So this demonstrated the country's commitment to eradicate the VAC, but also started and created enough momentum to conform something that we named the National Alliance to End Violence Against Children. So this actually, in concrete terms, was like a movement led by the Colombian Family Welfare Institute, that is the agency that coordinates the whole public policy portfolio for children, youth, and caregivers' well-being. And this started conveying, encouraging the participation of key actors, multi-sector actors, other ministries, agencies at the national and regional level, the civil society, academia, and multilateral organizations. So at the end of the day, the objective was to create a national action plan, which it was made. So now Colombia has a national action plan for the 2021-2025 period, which is a very potent public policy instrument. It's based on the Inspire toolkit, but it also integrated two important processes. First, a consultation process, including youth, national and local government agencies, NGOs, and other leaders of the sector, including private sector leaders and service providers. And it did a mapping of the existing actions, interventions, and strategies in the country. So this was good enough to start. It was informed by the data to action workshops the CDC and IOM led here in Colombia with the help of the Presidency of the Republic. And it generated something interesting that was using this data and using this whole movement. We created an Inspired coordination course in Colombia, which was meant to use the Inspire toolkit, but also to give enough other kinds of tools to local agencies and actors to start thinking about localized action plans, which was a very important strategy to trickle down the national action plan to local communities and agencies. And here it also has finally resulted in the production of new research, new evidence, thanks to the support of USAID and the HEART project and the support of the CDCs and UC Berkeley. Into 2020, we did a very nice, beautiful fellowship program to train and provide support to young researchers for them to use the VAX data and produce new evidence. And we have like very interesting research that is already, we have 3 scientific articles produced by these young researchers on topics such as evaluating intergenerational transmission of violence in Colombia, using the VAX of Colombia, but also El Salvador and Honduras to study the prevalence and configuration of adverse childhood experiences. That is a very well-connected branch of literature. And also to provide additional evidence on the impact of the internal armed conflict on children and youth, which is very special for Colombia because the sample of the VAX study in Colombia had the national level or representative level VAX, but it also had a special sample that is representative for the municipalities in Colombia that were especially or historically affected by the armed conflict. So this is actually something very interesting for us to understand how this 60+ year internal conflict has affected children and youth. And finally, other scientific articles have been produced with more senior researchers. 2 of those are already published in international peer-reviewed journals, and others are coming along. So I'm happy to share this another way.
Really amazing. And I think one of the things that really stands out is the importance of this kind of coordination, multiple sectors, actors, civil society, academia coming together, and then the issue of leadership that Kathleen highlighted as well at launch, like having at the presidential level, at the First Lady, I know was previously in the previous administration very engaged, that political visibility also being important. We are at a moment now, we're going to switch to some of the questions from the audience. I encourage you to put questions in the chat. We already have a first question. I'll ask Vivian and Arturo to try to be brief in their answers. I know we could spend 2 hours talking about all this stuff, but the first question, I'll give it to both of you, is around barriers. So what are some of the barriers or challenges? We've talked a lot about positive change, but what are some of the barriers you see and thoughts about overcoming them? So I'll hand it over to Vivian and Arturo to see who would like to answer that, or both.
Thank you, Daniela. For Kenya, one of the major challenges that we are experiencing right now is insufficient funding, limited resources to implement the plan because time is going. We are currently doing a midterm review, and we have realized that funding is a major challenge. As much as we have costed the plan, and we are still lobbying and advocating that the government increase budgetary allocation for implementation. COVID-19 pandemic was also a major setback for us because for a long period of time, nothing was ongoing. and that hindered the tracking of the implementation. We also are experiencing political transition now. As you know, we just had a general election, and the new government, in terms of bringing them on board and just having them understand what it is that we are talking about when we talk about ending violence against children, is also taking, it's a slow process for us here in Kenya. And then maybe lastly, I can just mention, Daniela, that culture. We are dealing with normalization of violence, and changing attitudes and behaviors is also a transition. It's a slow process that we are working towards, because we have various harmful cultural practices that we have normalized as, violence. Thanks.
Yeah, those are, I think, really important ones. I just want to mention, sorry, I forgot to mention this earlier, that for this Q&A part, we're also joined by Samantha Ski and Steve Whitaker, who represent University Research Company and are additional co-authors of the landscape analysis, and have done quite a lot in this sector. So they'll also jump in to answer questions as needed. I also want to just answer a couple of questions. Will the slides be shared with webinar participants? Yes. Will the presentation be made available? Yes. Those were easy. How about Arturo? I'll throw the next one out there and see, because this one's in Spanish. Let me try to translate it into English. How do you think that the results of the survey in Colombia can actually transform, the kind of tools that there exist around criminal laws, statutes, and those who face violence against children and adolescents?
So that's a complicated question, and I think I'm going to interpret it intentionally in the wrong way. So one of the topics we've been trying to understand is how adversity and how, for instance, being victim of violence, not only interpersonal, not only in the household, in the family, but also community violence, increases the propensity of someone become not only a victim in the future, but also a perpetrator. And this has like a very long and wide literature behind that, areas behind that, shows us that actually adversity changes even the brain architecture of persons. And for example, the regulation of emotions and regulation of behavior. So I think this trauma-informed perspective should be integrated, for example, in the young offenders legal system. That is important. That is a way to start truncating this this pathway and track of people that are just by the lottery of your cradle born in places where you are exposed to a lot of violence, and then violence begets violence, and it's just like a fast track through becoming a perpetrator. And this is not, I want to highlight, I'm not saying that this is like people are condemned to this, but it is important to have trauma-informed systems. About the other part, I don't know if there's another, in Colombia, we have had this debate on increasing the penalties to perpetrators as thought as an effective way of ending this drama. That has not been proven, and I understand the basic part of it, but I think it's more important about thinking how to effectively prevent, and that should be like our biggest worry. And I just wanted to say, Vivian, I was not very surprised, but somehow surprised, but the barriers that I thought for the other question are exactly the same. So in Colombia, we have the same lack of resources and these political cycles that affect institutional change.
That's a data point in and of itself. Yeah, these consistency of barriers. Listen, there's so many questions coming in. I love it. We're not going to get to all of them. I'm going to do one more and see who wants to jump at this. And that is that there's a question about the quality of interventions design based on VACs are kind of, and to address violence against children are lacking in evidence in terms of what's working, what isn't. I mean, we have Inspire, but how can we address this gap of really the evidence and the quality of the interventions that are being implemented? Who would like to take?
I can jump in. And so I think this is something that we're getting better at. I think there's an intention of having more monitoring and evaluation, not only to learn about effectiveness, because that happens at a certain stage of maturity of intervention strategies. It could also be about scalability, viability, quality of the processes. Sometimes that's where we should be focusing our research. But the intention of having a clear theory of change, a theory of change that explains us how are we expecting what we do to transform this reality, very clear and based on some science or some experience, and then having an intention to monitor and evaluate. And I think that culture of monitoring and evaluation and having this clear theory of change has a pretty deep, could lead to that. Not guarantee, but lead. Yeah.
Thanks, Arturo. Samantha and Vivian, did you want to answer that or any of the other questions that have come up?
Maybe just to piggyback on what Arturo has said in response to the last question around the sort of strength of the evidence around interventions to address and prevent violence against children. I think that another challenge in that area is sort of the complexity of violence against children and the multi-sectorality that we've been talking about and how relevant the different health and education and justice sectors all are. And so when you're talking about strengthening the evidence base, you're talking about many different sort of categories of interventions across different sectors. And so it really is complicated. But I think that, we've seen countries also doing a lot of work to review the evidence that is out there and design interventions that are informed by that evidence. But of course, yes, more evidence is needed, more implementation science work to tell us what works and in what contexts. Over.
Thanks, Samantha. Before I do our last question, Vivian, did you want to comment as well?
No, Daniela, not on that question.
All right. Well, then let's wrap up with the last question. And I'm going to ask you to do something really hard, which is in one sentence, tell us, or in two sentences, what gives you hope? This could be a really challenging field to work in. We talked about barriers. We've talked about progress. What really gives you hope for this issue moving forward?
Allow me to go first. What gives me hope? The findings of the VAC data survey results in 2019 showed that violence has actually reduced in this country. And that gives me hope. The fact that it is reducing, that means there's something right we are doing. And we are currently running a campaign referred to as the Spot It, Stop It campaign, where we're engaging the community and we are letting them bring these issues to the fore. And the fact that they are talking about it and speaking about it and are willing to intervene when they spot violence also gives me hope that there's, a light at the end of the tunnel.
Beautiful.
Thank you.
Samantha, you want to? Arturo, go ahead. Yeah.
Sorry, Sam. So to me, just very brief, three things. The first one is that violence, we know it's preventable. Also, that small things matter. Everyone can contribute to end violence. And the final one is that there is an amazing community of people working to end violence. So that's what gives hope to me.
Thank you, Arturo.
Yes. All of those really resonate with me as well, Arturo and Vivian, and maybe just to add, I think something that's kind of similar, but just the energy that we see across levels, from the local level, subnational governance, and the countries that have done it, the VACs working to adapt national action plans for subnational implementation, and then all the way up to the national and global levels. There's really strong momentum, and it gives me hope.
Thank you so much to the three of you. Really delighted to have this conversation. I know there were many questions we didn't get to. We can keep the conversation going online. And I'll just take a moment now to introduce our closing speaker. It's really a wonderful privilege to have Matito Watson with us here today. And really delighted to hand it over to you, Matito, to talk about, you know, where we are closing off. And Matito is the Senior Technical Advisor on Children in Adversity at USAID's Inclusive Development Hub, a partner and a longtime champion for children. Over to you, Matito.
Thanks, Daniela. And it's so great to see, you know, we talked about community at the end. It's so great to see so many members of this community that have been like fighters and champions for the prevention and response of violence against children. So I've had the personal pleasure of working with each and every one of them. I've been working with Vivian in Kenya on supporting some of their work around their national action plan. Dr. Harko and I have been working in Colombia for the past almost 5 years on really moving the agenda forward. And I think from a donor perspective over at USAID, you know, the report itself is really grounded in that evidence that we need in terms of some of our planning and moving forward on how do we support. First thing that comes up time and time again, there's not enough funding. And that's one area where we can continue alongside champions like at UNICEF, the Partnership to End Violence Against Children, to really be able to start to think around how do we help to influence, mobilize those resources. Because as we're building, if you think where we were 10 years ago or 5 years ago, we have grown so much as a sector, and we're starting to really move these pieces forward. And so you think about this innovation that's happening on the ground across the various countries that have done these 27 VAC surveys. Now we're really starting to pull together these mechanisms and this understanding on what works, what are some of those best practices. And although you have those barriers, such as, you know, culture and different political situations and different histories, we are starting to see some threads that we know work all across every single government that we're working with. So I only have a minute to wrap up. I just say that, you know, the US government has been dedicated in really addressing this issue. We have been one of the major funders of the Violence Against Children survey. We are fully dedicated to know that this data and this work that we do around bringing this data to governments and also out to individuals is a catalyst for change. And that in itself, even though it sometimes comes with a large price tag, we know can really move agendas forward. That's money well worth spending in order for us not only to better understand how violence is affecting children, boys and girls and others around the world, but how do we really use that violence and that data to move towards action? And I think where we are at USAID and others is really thinking around what are those best practices? What does that action look like? How can we learn from others from around the world? You know, WHO and CDC have done such a fantastic job, of course, like Together for Girls, UNICEF, others, in really pulling together that instrument and that process to get the data. And I think as we go into 2023 and beyond, we really want to look at how do we harness that data to really move towards action, and how do we really figure out what some of the best and brightest it is. I'll continue to be a champion within the US government to really bring that funding forward, but also to really help to facilitate to how do we convene, how do we collaborate, how do we work with all these other amazing individuals out there to make a change for children. So in my super short little window, I want to thank everybody for coming. Danielle, thank you for facilitating this fantastic webinar today. And it's a great way to start 2023. I'm really excited about us rolling up our sleeves and moving forward on this agenda.
Thank you so much, Matito. You are a champion. And to wrap up, I think you could see in this 1 hour the power of partnership. I'm reminded of the African proverb that says, if you want to go fast, go alone. but if you want to go far, go together. Thank you so much and have a wonderful day, everyone.